I think that's one of the big things I like to emphasize, especially in this population. We're throwing out the term like adaptive.
Right.
And for me, from like a medicine, like foundational standpoint, not a whole lot actually in my mind kind of changed. Yes, there are some unique aspects, but for me, the key thing, no matter if you're an adaptive athlete or any patient I'm seeing in the office, prevention is really the first place we need to focus on, because if we can prevent the injury from even happening, that's the key thing,
Yeah.
especially in this population, because if you do have an injury, they already have these impairments. So adding an additional injury to it can definitely change not only their quality of life, but just being able to independently complete their activities of daily living. So we've been talking a lot about like, wheelchair basketball and things like that. So
Hmm.
people who are dependent on a wheelchair, we definitely want to optimize their positioning in the chair to decrease that increased forces across that shoulder joint. So one example we do that. So, we do place the rear axle of the chair kind of slightly behind the athlete's center of gravity. It does allow the athlete to have a little bit better grasp and propulsion, just to kind of make mechanics a little bit more efficient there.
Hmm.
The wheelchairs have a more of an angle to it.
Hmm.
So
Yeah.
the at the base it's wider, and then it's a little bit more narrow at the top. There's a medical or biomechanical term, it's called camber, which again increases kind of the responsiveness to their hands in regards to turning, provides better stability. And again, as we've been mentioning with the contact aspect, it does allow your opponent not to be able to get as close to you, which is kind of nice from that standpoint.